This is the story of our journey so far, and the journey we need to take to get to 2020. Hertfordshire Community NHS Trust was formed 5 years ago, following a merger of a number of NHS services. Today it provides services such as school nursing and community nursing across the county. Most of these nurses look after children at their school or adults in their own homes. The Trust also provides many specialist services, such as dental and prison care, as well as expert care for children in West Essex. In recent years, the Trust has developed other services, featuring a range of clever people such as therapists, doctors and nurses, to support people who may otherwise have needed to go into hospital. These services have been successful and only work when there are close partnerships with other agencies such as social care, GPs and hospitals. Last year, HCT was placed in the top 120 places to work in the NHS. Everyone who went to its minor injuries unit was seen within 4 hours, and there was a big drop in cases of C. diff and avoidable bed sores. The Trust also celebrated having no cases of MRSA and really great patient feedback. The NHS needs to work more effectively in the coming years to cope with an increase in demand while facing reduced amounts of increase in funding. The NHS in England has a plan to look after more people while working more efficiently. It's called the 5-Year Forward View and was written by a team including doctors and nurses. Only by helping people to manage their own health, providing more care conveniently in their homes or close to where they live and preventing illnesses will the NHS be able to manage the challenges. It's not surprising that Jeremy Hunt, the Health Secretary, has said his biggest priority now is to transform care outside hospitals. There are 5 drivers for our Trust to change. They are the increasing population and the fact that people are living longer. The number of people aged over 65 in Hertfordshire will rise by 133,000 by 2037. We are caring for people with more complex long-term conditions. NHS money. By 2026, 1 million people are expected to have dementia. The cost of their care will be about £35 billion. And the opportunities new technology brings. Most people have access to the web through their mobile phones. The Trust's vision is to maintain and improve the health and well-being of people of Hertfordshire and other areas served by the Trust. Our values: care, respect, quality, confidence, and improve should be at the heart of everything we do. Looking at the current demand on our services, we can see that about a quarter of our budget is spent on helping people stay healthy, about 70% of the population. About 30% is spent on a fifth of the population to support them manage their own health. We spend about 45% of our total budget on just 10% of the population. These are people in greatest needs of our services. So what will we keep doing, and what will we change in the coming years? To start, we will ask our staff to be guided by 3 basic principles. We trust them to listen to patients, their families, children and carers and keep their needs central. We ask them to take responsibility, make decisions and behave consistently with our values. We encourage them to work positively in partnership with other organisations to maintain people's health and well-being. What it means for the people who use our services? People who are healthy will have access to good advice on how to maintain their health and well-being, as well as support from early intervention services. We'll look at issuing social prescriptions and providing opportunities for people to take part in health and well-being activities in their communities. Those living with 1 or 2 long-term conditions will have improved outcomes. People with complex needs will have an identified caseworker, a single care plan and a shared patient record. We will have reduced the amount of time they spend in hospital.